Professor Ganten, Professor Silva, Professor Rigatero, Excellencies, distinguished ladies and gentlemen. It's a great pleasure for me to welcome you in the name of the Federal Government of Germany to the 2018 World Health Summit. Today, we celebrate the 10th anniversary of the World Health Summit. And Professor Ganten, back then when I was MP, Member of Parliament in the Health Committee, and you came up, I know, to many colleagues and to me, with this idea, with others, of having a World Health Summit here in Berlin, in Germany, we were unsure how it would work, how it would go, how it would develop, and after 10 years, one can only say, thank you very much for that idea, after 10 years of the World Health Summit. Because over the past 10 years, the World Health Summit has become a key forum to discuss the most imminent global health challenges. We are proud to have this great forum of innovation and interdisciplinary exchange here in Berlin. Ladies and gentlemen, the perception that global health is something happening far, far away is wrong. Global health is present here and now. Global health affects all of us and influences our everyday life, also here in Europe and Germany. Two recent examples. 2 weeks ago, the UN held the 2 high-level meetings in New York, focusing on tuberculosis and on that's a not easy word for a German tongue. Non-communicable diseases, in short, NCDs. Let me begin with TB. In 1882, already 136 years ago, the German doctor and scientist Robert Koch announced the discovery of the tuberculosis pathogen here in Berlin. It is worrying that still today, after all these years, TB is the leading cause of death from a single infectious agent. In 2017, around 10 million people worldwide fell ill with TB and 1.6 million people died. A major challenge are the rising numbers of the drug-resistant forms of TB, especially in our region. 9 of the world's 30 countries with the highest burden of multi-drug-resistant TB are within the European region. The eastern part has the highest proportion of new cases of MDR-TB worldwide. The second UN high-level meeting on NCDs marks a paradigm shift. For too long, the global community has primarily focused on communicable diseases. However, the global burden of disease has shifted. Today, cardiovascular diseases, cancers, diabetes, and other NCDs kill around 41 million people each year worldwide. In other words, 2 out of 3 deaths are caused by NCDs. This trend is primarily linked to the global spread of unhealthy lifestyles, most importantly tobacco use, harmful use of alcohol, physical inactivity, and unhealthy diets. This highly impacts our societies as well as our health system and their financial sustainability. In Germany, NCDs account for around 90% of all deaths. I think this shows, just these 2 examples, shows the urgency that we are facing. So, ladies and gentlemen, 3 years ago, the global community adopted the ambitious Agenda 2030. However, already now, it becomes clear that we are falling behind in achieving SDG 3, namely, ensure healthy lives and promote well-being for all at all ages. We have to increase our efforts in order to reach the health-related SDGs in less than 12 years from now. This is our shared responsibility. All relevant actors have to rally behind SDG 3. Yet today, global health is as fragmented as never before. Global health is characterized by a confusing multitude of actors that often work parallel to each other. Even with regard to the main international health organizations, there is a large number: WHO, UNAIDS, the World Bank, the Global Fund, Gavi, and many, many other relevant organizations. If we want to ensure full implementation of the health-related SDGs, leaving no one behind, we need a clear and coherent plan. We need to know who is in the lead in order to avoid duplication and gaps and to ensure efficiency. The World Health Organization is the only international organization with universal political legitimacy in global health. And the World Health Organization was founded for exactly this reason, to act as the directing and coordinating authority in global health. This is why Germany, Ghana and Norway have asked Director General Dr. Tedros to bring all health-related agencies together and to come up with a coherent global action plan. We are proud that this SDG action plan will be presented during this World Health Summit. Germany remains a great supporter of WHO. We want to strengthen WHO's leadership role. And we are aware of the high expectations of the global public regarding the functions of WHO on the one hand and the reality of limited financial resources on the other. Long-term predictable finances for WHO remain a key challenge. Therefore, as the minister in Germany in the lead for the WHO, I am proud to announce that my ministry will be supporting the WHO with 150 million euros for the next 4 years. Never before we were able to guarantee such a high and long-term support for the core mandate of WHO. Because in providing predictable financing for WHO, we want to lead by example, and we want to make a real difference. The funding will support the coordination and the implementation of the SDG 3 action plan and the core mandate of WHO, activities where WHO has a clear comparative advantage. And let me just take the chance, I know Dr. Tedros is still to come, but yet, if you take the Ebola outbreak we are just facing again, if you see how difficult it was 4 or 5 years ago to deal with it and how long it took till we finally had vaccination on the ground, for example, a real help on the ground, and how fast it went this time with all the problems that are in the region there, you see how much has improved, and I just want to say thank you to everyone who is engaged here. Many, many people worldwide went down to that region. WHO is leading it. Thank you to everyone who is helping. Ladies and gentlemen, today the world appears more complex than ever before. Over the past years, we have seen major geopolitical changes that also impact global health. At the same time, the expectations towards Germany's engagement in global health have increased. Germany is seen as a proactive supporter of constructive multilateralism. We believe there is a clear need for Germany to redefine and clarify what specific added value we can provide for global health. This is why the German government has decided to work on a new whole government strategy for global health. The strategy will define our contribution to achieving the health-related SDGs. We are confident to adopt the new strategy by the end of 2019. Ladies and gentlemen, exchanging across sectors is key to meet the challenges in global health we face today and in the future. That is why forums like the World Health Summit are so important. I'm impressed how the World Health Summit has successfully brought together state and non-state actors, civil society, academia and the private sector for the past 10 years. The World Health Summit is a best practice example for building constructive dialogues with all relevant actors. I'm confident that we can only implement the Agenda 2030 if all relevant actors get involved together. This requires new formats. Therefore, we will set up a global health hub as an exchange platform for German and international players in global health. Our aim is to enhance intersectoral and interdisciplinary cooperation. Everyone interested is invited to join the kick-off event on the 3rd of December here in Berlin. I can't guarantee the same weather, though, but still, you are very much welcome to join us then again. So only together we are able to tackle the challenges ahead of us. Thank you very much.